Hey everybody, Dennis Stanley here with Lindsey Jones and Lindsey Jones University. Well, guess what? It's finally time to release the new 2027 NBRC RTE Lindsey Jones examination preparation material. And we're excited. It's not just a book. It's over 180 hours of comprehensive information and videos and narrated slideshows and quizzes and all kinds of other tools to help your students progress. This is the very best NBRC exam preparation material package that we have ever created, and we think it's the best in the nation. In fact, if you don't know, Lindsey Jones boasts the highest statistically published pass rate of any NBRC examination material, and we're only trying to make it better and better. I'll kind of share with you why that is in just a minute. But the first thing I want to tell you also about this book is that it is a special edition. In fact, the whole online course for the RTE is special edition because if you look at the fine print here, you'll find that it covers both the RTE and the TMC. Now, we've kind of racked our brains on this. So what do we do for students who are preparing for the TMC? They're not quite sure if they're going to make it on time or if they're going to make that certain cut pass rate so they can take the clinical simulation. And so what we've decided to do is for a little while bring a special edition together so that students have access to both courses at the same time. But if they order this course now, or you order this course now, one thing that is true, you're going to get a book that says RTE. But if you look closely, it's good enough to prepare for the RTE and the TMC together. There's a reason why that's possible and why we care about that. As you know, the clinical practice guidelines and the clinical content, the way we take care of patients and handle equipment, hasn't really materially changed from the TMC exam to the RTE exam. And so that's really about the same. But what is different is that there's about 30 or 40 new pages well spread throughout this book of information that's on the new RTE detailed content outline that's not on the TMC exam. And so it includes additional information. But if your students order this and they get this RTE book, one of the things that might be on their mind is that they're studying extra stuff that's for the RTE exam that they don't want to study because they're going to take their TMC exam. But let me explain to you another reason, a compelling reason why this is important. As right now, the NBRC has already announced that on the current TMC exam, they are using RTE validation questions. Now, I know that those questions don't count towards somebody's score, but as a student's taking that exam, it means that they could run across, likely would run across, different and new types of RTE questions, well, that kind of blow them out of the water because no one ever talked to them about that, determinants of health or professional consultation or whatever that new subject is. And so we feel like that's kind of a problem, that when a student goes to get on an exam, they're already full of anxiety, and now the first thing that happens, they see 2 or 3 questions that no one said anything about that subject to them, and it just increases their anxiety. As you know, as anxiety increases, their cognitive ability to think, even on those questions that they should and do know, kind of decreases. And so we think it's a great advantage for the students to incorporate this new 30 or 40 pages worth of other information that's not difficult, but when they read it, they understand, so that when they see it, even on the TMC exam, even though that question may not count, they at least know what that is and they know how to answer those questions. So we're very excited about that. Now, why is it that Lindsey Jones and Lindsey Jones University has become the best, most prolific, and most successful package ever out there? I get that question a lot, and I'm not sure I always know exactly how to answer it, but about half the country right now, if not more, is using Lindsey Jones University. And one of the reasons why is because of our belief system. We believe that our job is not just simply to read a book to somebody and tell them what to highlight that's on the exam, or even just give them a few videos, or even just 1 or 2 practice tests. No, we think they need a lot more than that. And so we also take very seriously the need to teach critical thinking, how to process the information that you instructors have already given them. You've done all the hard work, but how do we tie that together and apply that in a critical thinking method so they can answer those questions, especially the new clinical judgment questions on the RTE examination. So we think that that's very important. Because of that, it's also about practice. It's not enough, for instance, just to read a book and take 1, maybe 2 practice exams, and also can only take those for a few times, then I have to pay to take them more. So we just don't believe in that theory. So Lindsey Jones University is coming out with the RT and the TMC preparation material with 5 full-length examinations, and we're only adding to that in the future. future and in the coming months. But in addition to that, one of the things that I get most excited about is that as a student goes through the video lectures, the audio lectures, and reads the book, then they also have the ability, right after they've learned something, to take quiz questions. Now, that doesn't sound like anything important, but there's over 1,000 quiz questions. We just think it's very helpful and important that as soon as a student studies a section, that they immediately see 1, 2, 5, 10 quiz questions, some of which are simple and just help them to retain, but others which are very clinical judgment-like and like the NBRC examination. But the best part is, not only are they applying what they just learned to see the context of how it might show up in a question, but virtually every one of those thousands of questions has a lecture associated with it. That lecture may be anywhere from 1 minute to 5 minutes. So as they're looking at the question, we are lecturing them why the answer is the way it is, not just a rationale, but broadly teaching that concept again as it applies to that question. We have found that that is the most effective way to cause somebody to learn to critically think and to retain. And so that is what's special about LindseyJones University. I'll tell you something else, and this might be interesting to you, is that in some ways we're kind of sad to see the clinical simulations go away, and that's because it really upped the ante as far as teaching students how to critically think. What we have decided to do, however, is even though they don't have to take clinical simulations for the RTE exam, we now incorporate clinical simulations as a method for teaching two things: pathology and, of course, critical thinking. And so they're not going to be exactly like the old manipulative NBRC clinical simulations, but they are going to be a clinical simulation that we're calling critical thinking and pathology review exercises. So now we're going to use clinical simulations as a tool to teach pathology and to teach critical thinking, to augment your students' ability to take those clinical judgment questions on the NBRC exam. Look, I know you have a choice in who provides the material that your students desperately need to prepare for their NBRC exams. And for those of you who have chosen LindseyJones University, we thank you with our deepest heartfelt gratitude. If you've never used LindseyJones and you'd like to know more, we'll be happy to give you a tour and just kind of show you more specifically why it is that we're so effective in doing what we do. It's really kind of a work of the heart for us to help prepare your students for their NBRC exams. So if you are using LindseyJones University, we look forward to continue working with you as we update your material, prepare your students by having both the TMC and the special edition and the RTE examination material at the same time so that they're covered either way. Their anxiety can go down and your anxiety can go down as well. But if you're new to LindseyJones and you want to know more, we'll be happy to get online, give you a tour, and even open up a sample so you can play with LindseyJones for a little while. Well, we're excited to work with you, and we look forward to working with you in the future. I'm Dennis, president of LindseyJones and LindseyJones University. We'll see you around.